Acquired immunodeficiency syndrome, AIDS, is a life-threatening condition caused by the human immunodeficiency virus, HIV. HIV attacks the body's immune system, specifically the CD4 cells, T cells, which are essential for fighting off infections. Over time, HIV can destroy so many CD4 cells that the body becomes unable to defend itself against infections and certain cancers. When this happens, HIV progresses to its most advanced stage, known as AIDS. How HIV causes AIDS? HIV is a retrovirus that enters the body and integrates its genetic material into the host cells, effectively hijacking them to produce more of the virus. This process gradually weakens the immune system. AIDS is diagnosed when an HIV-positive individual has a CD4 cell count below 200 cells/mm superscript 3 or develops specific opportunistic infections or cancers that are indicative of severe immune suppression. Transmission of HIV. HIV is transmitted through contact with certain body fluids, such as blood, semen, vaginal and rectal fluids, breast milk. The most common modes of transmission include unprotected sexual contact, sharing needles, transfusion of contaminated blood, and from mother to child during childbirth or breastfeeding. HIV is not spread through casual contact, such as hugging, kissing, or sharing utensils, nor through insect bites. Stages of HIV/AIDS. Acute HIV infection. This is the first stage, occurring within 2 to 4 weeks after the virus enters the body. During this phase, individuals may experience flu-like symptoms, such as fever, sore throat, and swollen lymph nodes. The virus multiplies rapidly, and the person is highly infectious. Chronic HIV infection. Also known as the clinical latency stage, this phase can last for several years. The virus remains active but reproduces at lower levels. Most individuals do not experience symptoms during this period, but the virus continues to damage the immune system. AIDS. Without treatment, HIV eventually progresses to AIDS. At this stage, the immune system is severely compromised, and the body becomes vulnerable to opportunistic infections and cancers, such as Kaposi sarcoma and tuberculosis. Symptoms may include rapid weight loss, chronic diarrhea, extreme fatigue, and recurring infections. Symptoms of AIDS. The symptoms of AIDS vary based on the types of infections or cancers the individual contracts. Common signs include persistent fever or night sweats, chronic fatigue, swollen lymph nodes, skin rashes or lesions, pneumonia, neurological issues like memory loss or confusion. Diagnosis of HIV/AIDS. HIV is diagnosed through blood or saliva tests that detect antibodies or antigens associated with the virus. Common diagnostic tests include antibody/antigen tests. These are often used for initial screening. Nucleic acid tests, NATs. These detect the virus itself and are used for early diagnosis or to measure viral load. CD4 count and viral load tests. These monitor disease progression and help evaluate the effectiveness of treatment. Treatment for HIV/AIDS. There is currently no cure for HIV/AIDS, but it can be effectively managed with antiretroviral therapy, ART. ART involves taking a combination of medications that suppress the virus and prevent it from replicating. With consistent treatment, individuals living with HIV can maintain a near normal life expectancy and significantly reduce the risk of transmitting the virus to others. Preventive measures. Safe sex practices. Using condoms and having regular HIV testing can reduce the risk of transmission. Pre-exposure prophylaxis, PrEP. This medication is taken by HIV-negative individuals at high risk of exposure to prevent infection. Post-exposure prophylaxis, PEP. Taken within 72 hours of potential exposure, PEP can prevent the virus from establishing an infection. Avoiding needle sharing. Programs providing clean needles to intravenous drug users are crucial in curbing transmission. Mother-to-child prevention. pregnant women with HIV can take art to lower the risk of transmitting the virus to their babies. Impact of HIV/AIDS. The HIV/AIDS epidemic has had a profound impact on global health, society, and economies. Since its discovery in the early 1980s, the disease has claimed millions of lives. According to UNAIDS, as of 2022, approximately 38.4 million people were living with HIV, with 650,000 AIDS-related deaths reported that year. Sub-Saharan Africa remains the region most affected, accounting for the majority of cases. Stigma and discrimination. One of the greatest challenges in combating HIV/AIDS is the stigma and discrimination faced by those living with the disease. Fear, misinformation, and prejudice can prevent individuals from seeking testing, treatment, and support. Awareness campaigns and education are critical in reducing stigma and encouraging acceptance. The future of HIV/AIDS. Significant progress has been made in HIV research, leading to better treatments and prevention strategies. Scientists are working on vaccines and a potential cure. Community-driven initiatives, increased funding, and global partnerships are essential to ending the epidemic. Conclusion. AIDS remains one of the most significant public health challenges of our time. However, with advances in medicine, widespread education, and efforts to eliminate stigma, the fight against HIV/AIDS continues to make strides. Early diagnosis, access to art, and preventive measures can ensure a better quality of life for those living with HIV and reduce the disease's global impact.